medical research, and eliminate preschool development grants, which would stall the important progress states have made to build strong early education systems. In addition, the irresponsible proposal to eliminate teen pregnancy prevention while assaulting Medicaid and attacking the foundation of Title X family planning with the domestic gag rule is a dangerous combination that will leave many women without access to quality care, result in more unplanned pregnancies. This is an assault on women's health and the rights of women and their doctors. And I was dismayed, actually shocked, with the elimination of the federal funding we included in the fiscal year 2020 spending bill for the first time in 2 decades for gun violence prevention research. While you have supported this research in the past, I want to say that again, I'm aware that you have supported this research in the past. The budget makes clear that the president does not intend to do anything to combat the gun violence epidemic in this country. In addition, rather than invest in the ability of state and local governments to combat the vaping epidemic, which has led to at least 64 deaths, nearly 3,000 hospitalizations, this budget would consolidate CDC's Office on Smoking and Health, cut its funding at the very moment we need the CDC's expertise and resources. So if a budget is a statement of values, that it's clear that President Trump has no intention of protecting our young people or improving the health of Americans. But thank you so much for being here. I look forward to continuing the discussion.
Thank you. And I want to yield to the ranking member of the Full Appropriations Committee, Congresswoman Kay Granger from Texas.
Thank you so much. Before I begin my prepared remarks on the crisis that we're dealing with right now, I want to associate myself with Ranking Member Cole's remarks having to do with your good job and the planning that's gone on in this committee for such a long time. I'd like to thank Chairwoman DeLauro and Ranking Member Cole, who also serves as the vice ranking member for the full committee, for holding this hearing. I also want to thank you, Secretary Azar, for your efforts to protect our nation from this new coronavirus. Your immediate actions have enabled us to get ahead of the virus and begin protecting our citizens. At the beginning of the outbreak, you told members of Congress that you would let us know as soon as possible when more funding was needed, and you've done just that. I'm confident that Congress will work with you to make sure you have the resources in hand to continue to respond rapidly to this dynamic situation. All Americans should be reassured this morning that we have a robust public health system that's able to respond in every state to an infectious disease outbreak such as this. Congress has strengthened our state and local efforts with recent investments, including $85 million in the most recent fiscal year 2020 appropriation for a rapid response to an infectious disease. This is the very situation that led the subcommittee under the leadership of my friend Mr. Cole and Chair DeLauro to create such a fund, and I'm pleased to see that it is enabling your agency to mount a quick and proactive effort to keep our nation safe. I look forward to working with you and my colleagues in Congress as we continue to prevent the spread of this and other diseases within our country. I thank you for being here to testify today, and I yield back my time.
Thank you very much, Mr. Secretary. Your testimony, and as you know, your full testimony will be entered into the record, and now you're recognized for 5 minutes. Thank you.
Great. Thank you very much, Chairwoman Lowy, DeLauro, and ranking members Granger and Cole. Thank you very much for inviting me to discuss the President's budget for fiscal year 2021. I'm honored to appear before this committee for budget testimony as HHS Secretary for the 3rd time, especially after the remarkable year of results that HHS has produced in the last year. With support from this committee this past year, we saw drug overdose deaths decline for the first time in decades, another record year of generic drug approvals at FDA, and historic drops in Medicare Advantage, Medicare Part D, and Affordable Care Act exchange premiums. The President's budget aims to move toward a future where HHS programs work better for the people we serve, where our human services programs put people at the center, and where America's healthcare system is affordable, personalized, puts patients in control, and treats them like a human being, not like a number. HHS has the largest discretionary budget of non-Defense Department agencies, which means that difficult decisions must be made to put discretionary spending on a sustainable path. This committee has made important investments over the years in some of HHS's large discretionary programs, including the National Institutes of Health, and we're grateful for that work. The President's budget proposes to protect what works in our healthcare system and make it better. I'll mention two ways we do that. First, facilitating patient-centered markets, and second, tackling key impactable health challenges. The budget's healthcare reforms aim to put the patient at the center. It would, for instance, eliminate cost sharing for colonoscopies, a life-saving preventive service. The budget would reduce patients' costs and promote competition by paying the same for certain services regardless of setting. And it endorses bipartisan, bicameral drug pricing legislation. The budget's reforms will improve Medicare and extend the life of the hospital insurance fund for at least 25 years. We propose investing $116 million in HHS's initiative to reduce maternal mortality and morbidity, and we propose reforms to tackle America's rural health care crisis, including telehealth expansions and new flexibility for rural hospitals. The budget increases investments to combat the opioid epidemic, including SAMHSA's State Opioid Response Program, where we appreciate this committee's work with us to give states flexibility to address stimulants like methamphetamines. We request $716 million for the President's initiative to end the HIV epidemic in America by using effective, evidence-based tools. And this committee's support has enabled us to begin implementation already. Today, I'm pleased to announce that the Health Resources and Services Administration is dispersing $117 million in grants to expand access to HIV treatment and prevention by leveraging successful programs and community partnerships such as the Ryan White HIV/AIDS program and community health centers to reach more Americans who need treatment or prevention services. The budget reflects how seriously
it could continue its charter. Given the essential role that the Advisory Council plays in our nation's newborn screening system, why haven't you used this authority, and when will you extend the term of the committee until reauthorization occurs?
Well, first, Congresswoman, I'd like to thank you for your leadership with respect to maternal health and as co-chair of the Congressional Caucus on Maternity Care. As you know, maternal health is a very serious public health challenge in the United States, and our budget is actually investing in that thanks to your leadership and both chairwomen of this committee by increasing funding by $74 million at CDC, HRSA, ARC, and IHS to reduce maternal mortality and morbidity. We're going to continue funding.
Mr. Secretary, I was alarmed to learn recently that almost 90% of active ingredients used for pharmaceutical manufacturing originate in China. What should we be doing in the United States to ensure the safety of the American drug supply?
Well, Chairwoman, as you know, this has brought to light the issue of the complete internationalization of the supply chain, not just for medical products, but really across all of the economy. And so what we're doing now is the FDA is reaching out to all pharmaceutical manufacturers, device manufacturers, et cetera, to make sure we've got visibility. The latest fruits of that work show that there are 20 pharmaceutical products we are aware of to date at FDA where either the entire product is made in China or there is a critical active ingredient that is solely sourced within China. So those would be obviously the most targeted to be concerned about. To date, we are not aware of any expected shortages, and we have aggressively, proactively reached out to manufacturers for that information. I'm told there are 2 manufacturers in Hubei province of pharmaceuticals, but fortunately the manufacturer has a large stockpile supply of advanced production there. But we have to be very alert to this, and we have to be candid that there could be disruptions in supplies. We already experienced that, of course, with medical shortages, generic shortages, due to sole source producers, manufacturing defects, inspection problems, and we've got an aggressive agenda for shortages that we've worked with this committee and authorizing committees on to help alleviate shortages.
Good. Thank you, and would you keep us informed?
Of course.
Those?
Yes.
Thank you, Madam Chair.
there could be long-term health consequences such as heart disease, stroke, cancer, and more. This is particularly alarming as the youth vaping rates have skyrocketed. So I was optimistic when President Trump said he would clear the market of flavored e-cigarettes. But after speaking to his political advisors, he turned his back on public health for political gain and instead proceeded with an announcement that has left thousands of kid-friendly flavors on the market and allowed disposable e-cigarettes to flourish. How many more people will have to be sickened or die for the administration to take this seriously and ban all flavors?
Chairwoman, thank you for your passion around the e-cigarette and vaping issue and access for kids. I share that and want to keep working with you on this challenge. When the president made the initial announcement that with me on September the 11th, we included all flavors other than tobacco in that statement because at the time we had the National Youth Tobacco Survey data, which had mint and menthol together as a single category of use. We were actually at that time concerned about including menthol in the immediate removal from the market, given the fact that menthol combustible is a discrete legal category used especially in the African American community, and want to make sure that off-ramp would not be immediately pulled away from folks. After making our announcement, we got the Monitoring the Future data out of NIH that broke apart for the first time and showed that menthol was really not being used by kids. It was much more like tobacco flavoring of the e-cigarettes, and it was the mint that was driving it, and that was what led to the modification of the flavoring question there as we move forward to the submission deadline. We just also, with regard to disposables, we don't have data on disposables. Enjoy, the largest manufacturer, did pull their flavors off the market, is what they announced, the comparable kid-friendly flavors off of the market. But we're going to keep working and enforcing if anybody really build up a whole quality safety culture and mindset throughout IHS beyond just compliance with CMS certification requirements. So that's part of all that we're trying to do for Indian health. So
well, again, I'm very appreciative, and we're going to work with you where we can.
And from the outset, I and the public health experts have said we fully expect we will see more cases here in the United States. We have to be mentally prepared and also, as a government, prepared.
If I can, just to reclaim my time, it still didn't provide me the comfort I was looking for. Because the word from CDC officials, not a question.
Budget neutrality issues of a waiver, that's a major investment, could allow that for serious mental illness. Just one example there.
Congressman Pocan.
Great. Thank you very much, Madam Chairman, and thank you, Mr. Secretary, for being here. First off, let me just say your department's in the final stages of a regulation regarding the interoperability of healthcare data. More than 10,000 of my constituents work in the health IT industry. I just wanted to let you know that the outcome of this rule is very important in my district. I appreciate you listening to the concerns of comments. Look forward to the improvements that'll happen in the regulation, and I want to thank you for your leadership.
I've worked directly with EPIC leadership in hearing their concerns. I think often we put a proposal out, and we precisely because we want to get that feedback about operationalizing and everything. And so I hope that we're trying to be reflective of these concerns there as much as we can.
So let me try to get to the meat, which may not be as pleasant. I would love to get to talks about the cuts to Medicare and Medicaid, the cuts to NIH, but I really want to talk about the coronavirus. And I need you to help provide some comfort to the American people that this administration and federal officials actually have a grasp on this. Because let me just go down a little bit of litany of what I found in the news just in the last few days. We had the Secretary of Homeland Security, Chad Wolf, yesterday say a vaccine was several months away. The president said we're very close to a vaccine. And yet I think you and the CDC and others have said it's more like 18 months. We have heard from Commerce Secretary Wilbur Ross say that the coronavirus could be good for U.S. business because it hurts China. We have heard Larry Kudlow say it's contained. We have heard Rush Limbaugh, a Medal of Freedom winner and White House surrogate, say it's no worse than the common cold. And yet we've also heard from CDC officials not a question of this if this will happen anymore, but rather a question of exactly when. And Dr. Fauci, who many of us really respect, said it's inevitable. This will come to the United States. So we've got those kind of comments. Second, we know that this first started information coming around January 7th in the budget that was produced by the president on February 10th. Provided a number of cuts that would have actually worked to directly affect this, from the almost $700 million cuts to CDC, $167 million from the Office of the Assistant Secretary for Preparedness and Response, $18 million from the Hospital Preparedness Response Account, and $200 million cut to Project BioShield. We have seen recent reporting that 150 prescription drugs, and this is from the FDA, are at risk of shortage if this outbreak worsens, and yet the FDA Commissioner, Stephen Hahn, is reportedly not part of the task force that is planning the U.S. response to coronavirus. In 2018, the CDC cut 80% of its efforts as part of the Global Health Security Initiative to prevent global disease outbreaks because it was running out of money, and it was reported that the department could go from working in 49 countries to just 10 countries. Also in 2018, the White House official that was responsible for leading the U.S. response of the deadly pandemic left the administration, and the Global Health Security team he oversaw was disbanded. Finally, the tweet from this morning from the president talking about low-rating fake news, doing everything possible to make the coronavirus, spelled incorrectly, but I'm a journalism major, look as bad as possible, including panicking markets if possible, markets being the concern. So help me, is this contained, the common cold, inevitable, 2 months, 18 months? Provide me some security that someone knows what's going on in this administration about the coronavirus.
Well, thank you. Where shall I begin?
It's a long list of
what we're trying to do, and we've tried to do this with members of Congress, Senate, and the public and the media, is really flood you with information about this to make sure that we're being transparent about what we're facing, what we know and what we don't know, as well as what our plans are. So the risk right now is very low to Americans. We have, and as Larry Kudlow said, from a public health perspective, we technically are in a state of containment in the United States. We have had 14 domestically identified cases here from non-repatriation. That has remained the case now for 15 days. But we have always been clear that, number one, that could change rapidly. And from the outset, I and the public health experts have said we fully expect we will see more cases here in the United States. We have to be mentally prepared and also, as a government, prepared.
If I can, just to reclaim my time, it still didn't provide me the comfort I was looking for. Because the variety of statements I said are from 2 months, it's nothing, it's a common cold, to inevitable, and I still don't think this administration seems to have grasp on it. Let me ask you this, you're looking for the funds, I also agree with the bipartisan concern around stealing it from Ebola. I talked to a senior White House official last year, one of his two main, not White House, but administration official, one of his two main concerns he was dealing with was Ebola. So taking money from that would be ridiculous. Let me ask you this, we have redirected $3.8 billion from defense for the wall. The wall is not going to stop any real or imaginary migration, and it's certainly not going to stop the coronavirus. Would you be supportive of taking some of that $3.8 billion or any money for the wall and transferring it to take care of the coronavirus?
So the Ebola funding and and all of the transfers proposed in the supplemental, I do want to be very clear, that is simply a concept of how you could fund half of the supplemental. We are not wed to that. We wanted to give you ideas. On the Ebola money, that in particular, with Ebola, it is thanks to the Ebola supplemental funding we had before. It's important to note we have now an approved vaccine from Merck, and we now have 2 therapeutic candidates. I've been almost daily involved with the Eastern DRC Ebola outbreak that, God willing, is coming close to being under control. It's certainly on the epidemiological curve is looking more like that if the security situation stays. But I want to thank this committee for the support on Ebola that we've had, and we have now major weapons to use against Ebola, which is really a revolution.
And if I could, Madam Chair, just to the specific last part of the question, would you be okay with taking funds that have been redirected for the wall and redirecting to stop coronavirus?
I don't believe the administration would be supportive of that, but Congress will make the decisions about how to fund any supplemental.
All right. Thank you very much, Mr. Secretary.
Congresswoman Herrera-Butler.
Thank you, Madam Chair. And I want to commend you for your initiatives on advancing kidney health. Most people don't know that 750,000 Americans have irreversible kidney failure, and 90% of CKD patients are undiagnosed. So 9 in 10 people do not know that they're on this track. It represents, so then it's too late to slow the disease progression. So that's, Medicare spends more than $120 billion, 34% of total spending, and end-stage disease accounts for 7% of Medicare spending, despite representing 1% of Medicare patients, and this is only going to get worse. So my hat is off. I've been super excited about the initiative that the White House that you have launched to go after several of the problems within our current system, both to educate and inform and help people become more healthy, also to make sure that we're getting more solid organ procurements, that people are getting the transplants needed. And you're also going after the big fear for most people who have transplants, which is when is the immunosuppressive coverage going to end? Because I can't afford that. And so I just want to say thank you. It's a breath of fresh air to have someone really taking on this issue. It represents a lot of hope for a number of us who have been laboring in this field. I wanted to ask, there's two things, I have a lot of questions about the coronavirus, and I do appreciate, I've seen multiple options for members to come for briefings from your staff, from your team. So thank you for keeping us abreast. I do think it's going to change and iterate, like you said. I wanted to see if someone from your office would be willing to come in and just sit down with me about some real specific questions. How does it jump? What test kits are being made available locally? I saw something about commercial test kits becoming available. I think if it does iterate and it becomes communicable in each of our communities, we don't know how really our public health agencies and even our hospitals need to be able to test. That's what we're going to need. I know they keep saying it's only 2% of people die with this as compared with SARS, but those 2% represent the elderly. I mean, almost every article I've read, it's someone 70 years or older, or it's someone with a chronic illness. And I think we should be defending those folks to the best of our ability. So I know we probably don't have the time to go into that now, but I'd just love somebody to come in and spend a little bit of time with me on that, if that's...
We'd be happy to try to do that, or if we could address those, because those are questions everybody has, and so that might be.
Well, if you want to take a quick swing at it.
So in terms of
let me give you the three. How does it spread?
Right.
Is it on tabletops? How long does it sit there? How does it jump? And the test kits and their availability.
Right. So in terms of transmissibility, obviously, as a respiratory illness, it usually would transmit versus aerosol